Gonadotropin-releasing hormone agonist, Wikipedia audio. A gonadotropin-releasing hormone agonist is a type of medication which affects gonadotropins and sex hormones. They are used for a variety of indications including in fertility medicine and to lower sex hormone levels in the treatment of hormone-sensitive cancers such as prostate cancer and breast cancer, certain gynecological disorders like heavy periods and endometriosis, high testosterone levels in women, early puberty in children, as a part of transgender hormone therapy, and to delay puberty in transgender youth among other uses. GnRH agonists are given by injections into fat, as implants placed into fat, and as nasal sprays. Side effects of GnRH agonists are related to sex hormone deficiency and include symptoms of low testosterone levels and low estrogen levels such as hot flashes, sexual dysfunction, vaginal atrophy, osteoporosis, infertility, and diminished sex-specific physical characteristics. They are agonists of the GnRH receptor and work by increasing or decreasing the release of gonadotropins and the production of sex hormones by the gonads. When used to suppress gonadotropin release, GnRH agonists can lower sex hormone levels by 95% in both sexes. GnRH was discovered in 1971 and GnRH analogues were introduced for medical use in the 1980s. The most well-known and widely used GnRH analog is leprorelin. GnRH analogues are available as generic medications. Despite this, however, they continue to be very expensive. Medical uses. GnRH agonists are useful in women of reproductive age who undergo cytotoxic chemotherapy have been pretreated with GnRH agonists to reduce the risk of oocyte loss during such therapy and preserve ovarian function. Further studies are necessary to prove that this approach is useful. Suppression of spontaneous ovulation as part of controlled ovarian hyperstimulation, which is an essential component in vitro fertilization. Typically, after GnRH agonists have induced a state of hypoestrogenism, exogenous FSH is given to stimulate ovarian follicle, followed by human chorionic gonadotropins to trigger oocyte release. GnRH agonists routinely used for this purpose are buserelin, leprorelin, neferlin, and triptorelin. Final maturation induction after having performed controlled ovarian hyperstimulation. Usage of GnRH agonist for this purpose necessitates using a GnRH antagonist instead of a GnRH agonist for suppression of spontaneous ovulation, because using GnRH agonist for that purpose as well inactivates the axis for which it is intended to work for final maturation induction, treatment of cancers that are hormonally sensitive and where a hypogonadal state decreases the chances of a recurrence. Thus they are commonly employed in the medical management of prostate cancer and have been used in patients with breast cancer, treatment of delaying puberty in individuals with precocious puberty, delaying puberty pending treatment decisions in children with gender dysphoria, management of female disorders that are dependent on estrogen productions. Women with menorrhagia, endometriosis, adenomyosis, or uterine fibroids may receive GnRH agonists to suppress ovarian activity and induce a hypoestrogenic state, suppressing sex hormone levels in transgender people, especially transgender women, severe cases of hyperandrogenism, such as in congenital adrenal hyperplasia, as part of the pharmacologic treatment of paraphilic disorders in sexual offenders or men with a high risk of sexual offending. GnRH agonists that have been marketed and are available for medical use include buserelin, gonadotropin, gosrelin, hystrelin, leporelin, neferlin, and triptorelin. GnRH agonists that are used mostly or exclusively in veterinary medicine include deslorelin and furtirelin. GnRH agonists can be administered by injection, by implant, or intranasally as a nasal spray. Injectables have been formulated for daily, monthly, and quarterly use, and implants are available that can last from 1 month to a year. With the exception of gonadotropin, which is used as a progonadotropin, all approved GnRH agonists are used as antigonadotropins. GnRH agonists are pregnancy category X drugs. Side effects of the GnRH agonists are signs and symptoms of hypoestrogenism, including hot flashes, headaches, and osteoporosis. In patients under long-term therapy, small amounts of estrogens could be given back to combat such side effects and to prevent bone wastage. Generally, long-term patients, both male and female, tend to undergo annual DEXA scans to appraise bone density. There is also a report that GnRH agonists used in the treatment of advanced prostate cancer may increase the risk of heart problems by 30%. GnRH agonists acts as agonists of the GnRH receptor, the biological target of gonadotropin-releasing hormone. These drugs can be both peptides and small molecules. They are modeled after the hypothalamic neurohormone GnRH, which interacts with the GnRH receptor to elicit its biologic response, the release of the pituitary hormones follicle-stimulating hormone and luteinizing hormone. However, after the initial flare response, continued stimulation with GnRH agonists desensitizes the pituitary gland to GnRH. Pituitary desensitization reduces the secretion of LH and FSH and thus induces a state of hypogonadotropic hypogonadal anovulation, sometimes referred to as pseudomenopause or medical oophorectomy. GnRH agonists are able to completely shut down gonadal testosterone production and thereby suppress circulating testosterone levels by 95% or into the castrate/female range in men. Temporary suppression of fertility in female dogs, induction of ovulation in mares. Agonists do not quickly dissociate from the GnRH receptor. As a result, initially there is an increase in FSH and LH secretion. Levels of LH may increase by up to 10-fold. However, after about 10 to 20 days, a profound hypogonadal effect is achieved through receptor downregulation by internalization of receptors. Generally, this induced and reversible hypogonadism is the therapeutic goal. Following cessation of exogenous GnRH agonist, it takes 5 to 8 days before normal gonadotropin secretion is completely restored. GnRH agonists are synthetically modeled after the natural GnRH decapeptide with specific modifications, usually double and single substitutions and typically in position 6, 9, and 10. These substitutions inhibit rapid degradation. Agonists with 2 substitutions include leuprolide, buserelin, hystrelin, gosrelin, and deslorelin. The agents neferlin and triptorelin are agonists with single substitutions at position 6. Available forms: buserelin, deslorelin, furtirelin, gonadotropin, gosrelin, hystrelin, leporelin. Contraindications. Side effects. Neferlin. Pharmacology. Chemistry. Veterinary uses. Triptorelin. GnRH analogues are also used in veterinary medicine. Uses include